Welcome to the Consumer Advice Series on the About Mansfield podcast page. We are streaming live right now on Facebook. This is the first episode of the Consumer Advice Series, and this certainly will not be the last because we've got three of them today. Coming up at 11 o'clock, we're going to help build your wealth with Philip Washington Jr. He is a wealth advisor. And then coming up at noon today, we have, it's January, it's tax season. So we are going to talk taxes with Adam Cohen right here on the Consumer Advice Series. But today, chances are you or someone you know, I mean, this is how big of a problem this is. Chances are you or someone you know suffers from migraines. And the topic today, this morning, we have here on Zoom, Dr. Joseph Adams. By the way, this episode is brought to you by Calibration Chiropractic and Functional Health. We welcome Dr. Joseph Adams to the Consumer Advice Series. Welcome.
Thanks. Glad to have a chance to talk with you guys this morning.
And let's start with you before we get into the topic here, because just give the audience an idea of how many hours have you spent studying just migraines alone?
Wow. I would say a couple of years, if you had to do it didactically, like according to school criteria, maybe 90 to 120 hours study.
So can you think of, without naming names, is there anyone else here in the Mansfield area that has the level of expertise on migraines that you have?
It's possible, but I haven't really met them yet. So it's definitely a passion of mine. And if there is somebody else who's a practitioner who's very passionate about it, I'd love to chat with them, because it's definitely a population that needs a lot of help.
All right. So let's call you Mansfield's foremost expert on migraines. Why not?
That's a good
All right.
title.
Let's get into the nuts and bolts. First of all, what is a migraine?
Yep, that's a very good question, Steve. Migraines are, by their nature, a complex neurological disease. And I think that that's one of the biggest things people need to realize is I think a lot of times people mix up migraines with other types of head pain conditions. And unfortunately, for those that suffer migraines, it is a neurological disease that is only going to get worse without mitigation or treatment over the lifetime of a sufferer. And the best way to describe what's going on with a migraine is that people who have migraines are usually genetically predisposed to have them, and they are typically female. So a 3 to 1, two out of three will be female. So big preponderance for females to have them. And it is a neurological condition that is characterized by sensitivity. The migrainer's brain is very sensitive, and that sensitivity is what leads them to having all these different triggers that can bring about a pain syndrome. And, one of the bigger things that, we look at with migraines, when somebody comes in and we're trying to decide, hey, is this migraine or is this a tension type headache, which is actually the most common head pain disorder, is what does it feel like? Is it something that they're having only on one side of the face, or is it something they're having all over the face? And those are just some of the things that we look at.
All right. And how do people tell the difference between a migraine and, say, a simple headache?
Yeah, exactly. Yeah, that's kind of what I was kind of leading into there, is that, a lot of times migraines and headaches, unfortunately, can look very similar to the person who's not trained. And the diagnostic criteria for this is actually very hard if you look at the literature. But I'm going to summarize it just so it's very easy for the consumer. And there's always, rules that can be broken in healthcare, if you will. But for the most part, a migraine is a head pain disorder that is only going to be felt on one side of the head. So it's not going to go from left to right. It's going to be unilateral, so only on one side of the face always. And it has a couple other characteristics. One is that it's going to be more painful, pulsatile in nature. So, like a throb to it, usually made worse by physical activity once it starts, can have nausea and light sensitivity. So if it's on one side of the head, it has the other one of those other two criteria as well to go along with it, then most likely we're dealing with a migraine. And sometimes people actually have neurological changes before they
Yeah.
have head pain. And I'm sure you've heard of that. It's called an aura.
And then how does a person, all right, the migraine has started, you're sensitive to light, you basically have balled yourself up into the fetal position on a couch and thrown a blanket over to you. That's probably not the best way to treat a migraine. Help me out with that.
So if we're talking about treatment for migraine, when you're having an attack, well, there's a lot of options there. There's medications on one end, which is not my specialty per se. I have a good amount of training on understanding what the different current approaches are, and then on the other side of the spectrum, there are therapies, there are supplements, there are other things that you can do, lifestyle factors. So there's a broad spectrum of treatment when you're in the actual phase. And that's definitely something we're going to cover as we go through this series is what some of those things that people can do at home that are safe, minimal side effects, and are shown to be pretty effective, as effective some of these things as some of the medications.
Right. And this is not just a one-time interview. You are going to be here every week, every Friday at 9 a.m., streaming live on Facebook, the Consumer Advice Series. And this is why we call it a series and not just one and done. Today is basically just Migraines 101, but over the next several weeks, we are going to be getting into the nuts and bolts of what a migraine is. Now, it is a migraine. These are it's a disease. You've mentioned that. It's recurring. Is it possible to get rid of migraines permanently?
So I would say that getting rid of a migraine permanently is most likely not on the table if you're dealing with somebody who has a true migraine disorder. And I just say that, reiterate that, because a lot of people that have been told they have migraines actually don't have them. They have tension type headaches, which is great. I mean, those are really easy to fix. But if you have migraines, unfortunately, you're probably a female, and it's going to affect you predominantly from your young teenage years all the way to your late adult years. And so really the most productive years of your life are most likely going to be trouble with migraine pain. And now there are a lot of great therapies and treatments that we do that can reduce the burden so that people can get out there and work and live productive lives with minimal side effects. But unfortunately, no, it's not something that can ever be cured. It will get better as the female usually ages, and hormonal changes and things like that take place. But during the productive years, usually not. It's all about mitigation and treatment.
And so just keeping the amount of attacks down and keeping the symptoms to a minimum. Let's talk about
Exactly.
migraines versus other head pain disorders. Are there similar head pain disorders that you may think you're having a migraine, but it could be something else?
Yes, yes. And that's what I've kind of alluded to previously is that a lot of times people, I would say most commonly, are having a tension type headache. And so what that means is that you have, too much tension in your neck, and that tension actually just irritates the nerves that are responsible for head pain. And so this is the most common headache disorder. Actually, it's a secondary disorder because it's secondary to neck tension. It's about 60%, of all head pain events are neck tension. And so the big difference there is that you're usually going to feel that your neck is tight, and you're going to feel that you have discomfort in the base of the skull. And it's usually going to start there and then go up and maybe wrap, and it can switch sides. It's not pulsatile. It's not as severe in nature, and it is a lot easier to treat. And so those are really the two big ones. People usually either have the tension type or they have migraine. So, but they look very similar to the untrained eye.
Dr. Joseph Adams, the foremost expert on migraines right here in Mansfield. Dr. Joe, if someone had some more questions about migraines, how can they get in touch with you?
Easiest way to find us is on calibrationchiropractic.com. And if you search for us, there's many ways that you can get in touch with us if you have questions.
That's Dr. Joseph Adams. We will see you again next week, Friday, 9 a.m., streaming right here live on Facebook. If you missed the live stream, you can always find us on YouTube. We've posted the video also on LinkedIn, and we'll do it again next Friday. Thanks for being here.
Thanks for having me.